This video is a Sawbones demonstration of lantern hip supine, designed for the direct anterior approach where the patient is positioned in the supine position. For users utilizing the leg length feature, ensure draping is distal enough on the thigh to secure the thigh plate on prepped skin. Secure the thigh plate with a strip of ioban. Place the bone pins into the ipsilateral iliac crest in parallel orientation, with the pins traveling between the tables of the iliac wing. Use the drill guide to properly space the second pin. Next, attach the pelvic bracket and fully tighten down the two bottom screws. For users performing the leg length workflow, place the tack into the anterior greater trochanter before the femoral neck resection, ensuring it is in hard bone. Then, mount the construct and ensure the unit is 45 degrees tilted to the floor. The probe can reach the femoral tack, then tighten the final screw. Registration begins with the anterior pelvic plane registration. Using the probe, palpate to the ipsilateral ASIS, then the contralateral ASIS, and finally the pubis. This establishes the anterior pelvic plane and the coronal plane for cup inclination and version calculations. Next, for users performing leg length measurements, move on to femur registrations. Align the probe scale with the femur to establish direction, then tap register. Then, register the femoral tack by placing the probe into the tack and selecting start. Wait for the red hand to disappear, then transfer the femur sensor to the thigh plate and tap register. This completes lantern hip quick registration. Next, the surgeon completes the femoral neck resection and acetabular reaming. During this time, the scrub tech should remove the probe from the lantern hip construct. For cup navigation, only the femur sensor is used. Provisionally place the acetabular cup, ensuring the appropriate adapter is attached with the arrow pointing towards the cup. Tap start to begin. Wait for the red hand to disappear, then transfer the femur sensor to the impactor. The surgeon can now view and adjust live inclination and anteversion in the coronal, APP, or functional planes if selected. In addition, pelvic tilt and rotation are displayed, allowing the user to identify any change in pelvic position during the case. Because the lantern hip system tracks pelvic motion in real time, cup angles automatically adjust to any movement on the table. Once the desired cup placement is achieved, tap register to save the values to the surgical summary. Before impacting, be sure to remove the femur sensor and navigation unit. Note that the surgeon has 45 seconds to complete cup navigation, but this step can be repeated as many times as desired. This concludes the acetabular phase of the lantern hip workflow. For surgeons performing leg length measurements, please proceed to the next steps. After the liner has been placed, but before broaching, proceed to the liner registration step. Reattach the probe to the lantern hip construct. Select the appropriate liner registration trial from the hip set, in this example, a 36 millimeter of liner. Ensure the liner trial is fully screwed on and fully seated into the acetabular liner. Tap start to begin and wait for the red hand to disappear. Then transfer the femur sensor to the wand and place the probe into the divot and tap register. This registration will be used to calculate change in leg length. At this point, the surgeon can remove the lantern hip construct and proceed with broaching and preparation of the femur. After broaching is complete and the hip is reduced with trials or final implants, reattach the lantern hip construct to the pelvis and secure the thigh plate to the thigh mount. Insert the probe into the femoral tack, then tap start to begin. Wait for the red hand to disappear, then transfer the femur sensor to the thigh plate and tap register. The surgeon may now view change in leg length relative to the initial registration. If desired, the surgeon may tap more info to view offset. The user may also repeat the leg length measurements by tapping the repeat icon. This concludes the lantern hip supine workflow. Before wound closure, ensure proper removal of the femoral tack and bone pins.